Yes. Hi. Hello, everyone. I'm audible. I'm audible, guys. Audio videos are clear. Yes. Grish GT. Good evening. Kirti, Kerudi, Charanas, Rahman. Good evening, all of you. How is your preparation? How are you? How is your preparation going on, guys? How are you? Okay. Chalo, ditto. We will have detailed discussion about it after the class. Okay, don't worry. So, how is the preparation? Sharan, how are you? How are you, Charan? How is the preparation going on? Nice. Malini? Yes. Rahman, how is your mental status? Are you confident? Are you positive? Okay. Good evening, sir. Nice, sir. Okay. That's great. That's great. All of you. Fine. So let's start. Okay. To begin with, so we have one very, very, very important line, the confidence and the hard work. Confidence, that is positive mindset, very important. Then hard work, revision, hard work, the very important component of any preparation, any preparation, not only medical, any preparation, IS preparation, USMLE preparation, whatever preparation, need hard work. Okay, is the best medicine. Okay, so it is the best medicine to kill disease called as failure. Failure. So failure is something very common in everyone's life. The best medicine is regain confidence, do hard work. Then it will make you a successful person. So one day you will become very successful. So be confident. All is well. You can try your level best. So all of it, type in the chat box. All is well. I will try my level best in the chat box. Come on, guys. Keep writing. So Vinay is telling sir, okay, I'm okay. Chalo, that's okay. Vinay. Shashank, okay. Shashank, how is the preparation? Last exam, Shashank. Theory exam. After that, you are free. Hmm? Nazba Tania, how is the preparation? Good evening. All is well. I can do it. All is well. All is well. I'll do it, sir. Okay. Good. So let's start now. So yesterday we discussed the 20 important questions in physiology, that is paper 2, and today we're discussing 20 more important questions, especially detailed discussion of 10 questions, and after that the 10 question is homework for you. You can go through that after the class. So this 40 question probably the most commonly asked question in our upcoming exam. Okay, yes, chalo. Not I started, that's okay, fine. Okay, chalo. Before that, let's see what is the distribution of topics in physiology 2. Neuromuscle physiology, that is 12. Neuromuscle physiology. So especially the muscle contraction, myasthenia gravis, Eaton-Lambert syndrome. So clinical question. Okay. So and neuromuscular junction, slow muscle fibers, fast muscle fibers. Slow. Okay, all these are commonly asked. Endocrine physiology, one very important, diabetes mellitus. So diabetes mellitus, very important question. Thyroid gland, Cushing syndrome, adrenal gland, growth hormone, acromegaly, gigantism, dwarfism. Yes. Then reproductive physiology, menstrual cycle. What are the ovarian changes? What are endometrial changes? And what are the uterine changes? All these are commonly asked. Then CNS. CNS is basically 32. So the CNS. So 32 marks. Special senses, 10. That means special senses and CNS. So both include around say 42 marks in upcoming exam. Then comes is your integrated physiology, that is around 7 mark, and the ETCOM. So ETCOM is not there for RS5 and RS6, only for RS7, that is basically 5 mark. So is it clear? So we have 2 more days. So just go through this distribution of topics and concentrate on weak areas and the weak concepts. Okay? So all is well. Okay, let's start. Let's start now. First question. First question. So this is one very important question asked in the exam. So all of you go through this question and try to answer. A 56-year-old woman comes to your clinic for annual physical exam. So yearly physical examination, a general checkup. Increased urinary frequency. So she is having polyuria. Also having polydipsia. Okay, she is having polyuria, polydipsia, and polyphagia as well. Polyphagia. So 3 P's are there. She is obese. She is obese. As you know, in obesity, there can be insulin resistance. So here there is an insulin resistance. Insulin resistance. Does not exercise. No exercise. Then regularly eats fried food, like this fried food. KFC, NFC and all, no, fried food. Eating this every day. So, and her random blood sugar is 223. So more than 200. It is 223. Random blood sugar. That is after food. Random. Then hemoglobin A1C is 9.2. Hemoglobin A1C is 9.2. So what is the diagnosis? Can anyone answer? So what is the best diagnosis of this condition? Polyuria, polydipsia, polyphagia, insulin resistance. What is the diagnosis? So this is a case of type 2 diabetes. Very good. So this is a case of diabetes mellitus type 2. Type 2. Excellent. Excellent. So it is an adult onset type of diabetes mellitus. So 3 P's: polyphagia, polyuria and polydipsia. So polyuria because of the increased glucose levels in the blood. Okay. Polydipsia is because of, again, that is because of the increased osmolarity of the plasma. Yes. So okay. Yes, fine. Type 2 diabetes mellitus. All answering. That's great. Chal. So now we will have discussion about this from the standard textbook. So try to understand this. So this is taken from one of the standard textbook. You can see here there are 4 types of cell in the pancreas. Very important MCQ. So there are 4 types of cell: alpha cell, glucagon; beta cell, basically that is basically secretes insulin. Okay, delta cell secretes somatostatin, and F cell secrete pancreatic polypeptide. So there are basically pancreas, there are 4 types of cell: alpha, beta, gamma and F cell. So this is very commonly asked in the exam. No, it is not Shambulingam. This is not Shambulingam. Rahman, this is not Shambulingam. This is one more good book. Better book than Shambulingam. Okay. So this is what you need to write in the exam. So pancreas you can write, and you can write the different types of the cells and what are the functions of that. Very important. Not Shambulingam. This is not Shambulingam, guys. Look at this. Scientist contributed, physiological anatomy, all this. No, that is not there in Shambulingam. You will not get this scientist details and all in Shambulingam. Okay. AK Jain भी नहीं है. AK Jain भी नहीं है. ये कौन सा बुक है? बताओ AK भी नहीं है. ठीक है. So this is taken from your GK Paul. This is taken from GK Paul, guys. Okay. Chalo. Now the important concept is what is normal blood glucose level. What is normal hemoglobin A1C? That is very important. So look at this, all of you. So normal blood glucose level in normal person, 60 to 99. Okay. Impaired matlab 100 to 125. Diabetes means more than 126 is diabetes mellitus. So more than 126 is diabetes mellitus. And you see the random blood sugar, it is less than 140 in fasting. So 140 to 199, that is basically impaired, and anything more than 200, so basically that is diabetes mellitus. And also you can see here anything more than 6.5 is diabetes mellitus. So for me, three important keywords here: 126, 200 and 6.5. So all of you write in the chat box 126, 200 and 6.5. So 6.5, that is equal to diabetes mellitus. So write this in chat box. Keep writing. 126 is a good score. If you get 126 out of 150, good score. 200, more than 200, 6.5 percentage. So this is diabetes mellitus. So 126, that is FBS. More than 200, that is RBS. More than 6.5, that is basically hemoglobin A1C. So all of you keep writing this. Keep writing, guys. So don't forget this. This is very commonly asked. Yes, okay. Syed Abdul Rahman, okay. Shashank Pujar, ठीक है? Yeah, so this is fine. Now see, now one funny example. See, now I am very hungry. So now what is normal fasting blood glucose? Now I am hungry. So now you can see idli vada is there waiting for me, but I am very hungry now. So what is my normal fasting blood glucose level? Can you tell me what is that? See, me normal, non-diabetic. I don't have any diabetes. My blood glucose is absolutely normal. So normal person fasting blood glucose कितना होना चाहिए? That means before food. Idli vada you can see there, clearly visible, है ना? I need to start now. I'm in fasting basically. 60 to 100 है ना? Very good. 60, 60, 70, 80, that is normal. ठीक है, ये भी ठीक है. Very idli vada है. ठीक है, good. So should be less than 126. After having this, should be less than 126. If I'm having more than 126, that is random blood sugar. So that is fasting blood sugar more than 126, that is definitely diabetes mellitus, right? More than 200, that is also diabetes mellitus. Very good. Okay. So fasting and all we discussed, right? Now comes is what are types of diabetes mellitus? So what are types of diabetes mellitus? Types. So what are types? 1, 2, 3, 4. 1, 2, 3, 4. So one is diabetes mellitus type 1, which is known as juvenile diabetes mellitus. Juvenile. So it starts in the young age group. Second one, diabetes mellitus type 2, which is known as adult onset. Adult onset. Type 3, that is MODY. MODY लिखना आपको. MODY, maturity onset diabetes mellitus in young. Maturity onset diabetes mellitus in young, that is known as MODY. Then is GDM, gestational diabetes mellitus. So this is what given in your standard textbook GK Pol. And again remember, in type 1 it is the drug of choice is insulin. Insulin. The common side effect of taking insulin is hypoglycemia. Type 2 basically, that is oral hypoglycemic drug. Oral drugs. So these are all very important question. Okay. GDM, MODY and GDM. Good. So good point. Good. Chalo. Now here you must know one more important concept. What is the common complication of type 1 diabetes mellitus? Your answer should be diabetic ketoacidosis. diabetic ketoacidosis. Okay. In case of type 2, it is basically hyperosmolar coma. Hyperosmolar coma. So very important concept. You need to mention in upcoming exam. Okay. Mention in exam. Okay. So that's great. Chalo. So next. All of you okay understood? Is any doubt in this? Okay. Chalo. Now difference between type 1 and type 2. And before that, what are the actions of insulin? This is taken from J.K. Paul. So after the class, go through this. What are the actions of insulin on liver? What happens in liver? So what happens in skeletal muscle with the help of insulin and in the adipose tissue? And in adipose tissue, this is very, very important. Very, very important one. You can take a screenshot of this and you can revise. Actions of insulin. Actions of insulin and actions of glucocorticoids. Both are very commonly asked in the exam. Okay, all of you guys, okay? You're getting my point? Yeah, okay. Next. Types of diabetes mellitus, okay? Difference between type 1 type 2. Again, this you just go through after the class. So type 1, age of onset, body fat mass, incidence, genetic susceptibility, incidence of ketoacidosis, B cell mass, nature of onset and usual complication. Again, this is important. So you can take the photo of this, you can take the screenshot and you can revise. Differences between type 1 and type 2. Type 1 is known as juvenile diabetes mellitus, type 2 known as adult onset diabetes mellitus. Okay, this is okay, fine, all of you guys. I'll go a little fast. Then one more 3 marks question commonly asked in relation with diabetes mellitus. Metabolic syndrome. What is the metabolic syndrome? So metabolic syndrome, you can see the image here, very interesting image. Hefty man, so having heart disease, lipid problems, hypercholesterolemia, hyperlipidemia and all. Then hypertension, and also having hypertension, type 2 diabetes, dementia, cancer, polycystic ovarian syndrome, especially in case of females. Then non-alcoholic fatty liver disease. This is known as syndrome X, also known as metabolic syndrome. In these people, diabetes is very common, heart attack is also very common. So all of you write in the chat box, metabolic syndrome is equal to insulin resistance. ठीक है, that is also okay. Kai kalu sanna hotte dumma. Okay, good. Charan, are you enjoying class? That's great. Chalo. Next comes is your you tell me what are the treatment options in diabetes. So in any question you can just write about the treatment also. What is the treatment? Can you tell me all of you what the treatment of diabetes mellitus? Come on guys, come on. Treatment of diabetes mellitus. Syed. So Charan, I need one answer from your side. Sir, medicine early stage. Good, Shashank. Medicine, insulin in type 1. Yes, good. Insulin is one option. Insulin and oral hypoglycemic drug, oral drugs. Now, one more important is lifestyle modification. Can you tell me what are the lifestyle modification in diabetic patient? Okay, insulin injection in type 1 only, not in type 2. In type 2, we give oral drug. What are lifestyle modification? Say example in metabolic syndrome. What is the advice you are going to give it to him? So this dodda hotte, sanna kalu, sanna kai, what advice you are going to give? Shashank Pujar. Batao. Lifestyle modification. Lifestyle. What is lifestyle? That is basically. So decrease obesity, exercise. Do exercise. Very good. Exercise करना पड़ेगा. At least 20 minutes walk. 20 minutes fast walk. Remember 20 minutes fast walk. Then also food control. So he should avoid a masala dosa. He should take only idli sambar, not the masala dosa. Then don't take oily food, है ना, like this. Obesity कम करना पड़ेगा. इसके बाद smoking, alcohol, yes. Then also yoga. Okay, yoga, meditation, very important, because that will decrease the stress levels in the body. When stress level is decreased, stress hormone level decreases, there will be automatic control of the blood glucose level. So you need to tell exercise and the food habit and yoga and meditation. So this is what important, walking and healthy food. Okay, good. So this is what, okay. Now question is, why polyphagia and diabetes mellitus? This is again 3 marks question. 3 marks question. Why polyphagia? See, why polyphagia and diabetes mellitus? Imagine this girl is having diabetes mellitus and she is eating like anything. Okay? So my question is, why polyphagia in diabetes mellitus? What is the mechanism of polyphagia in diabetes mellitus? Yesterday we discussed hypothalamus, hunger center and satiety center. It is something related to that. Can anyone tell me? Hey Shashank, polyphagia, why? Why? Because it is because of stimulation of, satiety, inhibition of satiety center. Satiety center yesterday we discussed, that is VMH. Okay, VMH inhibition and stimulation of feeding center, that is basically lateral hypothalamus. Ventromedial hypothalamus basically for satiety and lateral hypothalamus basically for what? That is the feeding. When these two, so basically it is there is a loss of inhibition, but satiety center is actually not going to work in case of insulin resistance or diabetes mellitus. So this is what the concept you need to write in the exam. So the polyphagia in diabetes mellitus because of the inhibition of satiety center and the stimulation of lateral hypothalamus. Yes, lateral hypothalamus. So all of you okay? Understood this? Understood? Very good. Malini is telling, sir. Okay, great Malini. So NEET online, great. Chalo. Next. Next insulin deficiency and all we can just write in the exam. That's okay. Then I said lifestyle. It is given in GK Paul. Sir, calorie intake कम करना पड़ेगा. तो calorie कड़मे तो होगा. Okay. Regular exercise, morning walk is given there. Free hand exercise like this. Free hand exercise. Like this. Free hand exercise. Some exercise like this. Free hand exercise. And that will improve the insulin release and also decreases insulin resistance. Then relaxation of body and mind. So healthy body, healthy mind without stress, very important. Practice of yoga. This is what given in GK Paul, guys. So GK Paul line. This is not my line. This is GK Paul lines. So all of you getting my point? Food intake should be adjusted to requirement. Excess intake should be avoided. So it should be less carbohydrate and the fat. More fibers is important. So more fibers, more vitamins and more proteins. Less fat and basically the less carbohydrate, less oil and all. So this is what very important. चलो ठीक है, ये समझ में आ गया. GK Paul line. So ಏನು ಮಾಡಬೇಕು ಸರ್? ದಿನ ಇಡ್ಲಿ ವಡೆ ತಗೋಬೇಕಾ ಇಲ್ಲ ಮಸಾಲೆ ದೋಸಾ, everyday ghee dosa, roasted ghee dosa. So afternoon, evening snack dosa, afternoon some fried food, some biryani, night also full of biryani. Is it good or what do you think? Is it good or bad? You just tell me good or bad. Okay, tell me, good or bad? So chasing dreams, I sir, I'm Yashwant Kumar. I am your big fan. I am also a fan, Yashwant Kumar. Okay, we both are mutually fans. Okay, you are my student, so I am your fan. I am your guru, and you are my fan. I agree with that. Yashwant and Prashant, great. Hmm. Okay, bad sir. Okay, no sir. Fasting alternative is good. So Charan is telling sir bad. Okay, chalo, chalo, good, good. Shashank, is it good or bad? So Manthan, are you there? Manthan, is it good or bad? Very bad. Okay, that's okay. Chalo. Now the comes is the complications. What are the complications of diabetes mellitus? So complications of diabetes mellitus, very commonly asked. So remember, there are three pathis are there. One is retinopathy. Retinopathy. So there will be aneurysm in the retina. There can be blindness, vitreous hemorrhage. There can be neuropathy. Neuropathy. There can be peripheral neuropathy and all. Then there can be gangrene, so diabetic foot and all. And there will be nephropathy. So nephropathy. So very important. So there can be gangrene. So gangrene of the limb, that is known as diabetic foot. So this you need to write in the exam. Three pathies. So I'll have to write in the chat box three pathy. So three pathy in diabetes mellitus. 3 marks question. Mention three complications of diabetes mellitus. Three pathies you can write. Okay. Neuropathy, retinopathy, and okay, that's great. That's great. All of you, great, great. You are answering well. Pakka question, diabetes mellitus, main question, 10 marks question, 5 marks question, 3 marks question. So just go through all this. Chal. Next comes is, okay, I said yoga is good, meditation is good. So how many of you are doing yoga, meditation every day? How many of you doing some exercise, some yoga, meditation every day? In exam time, this is important, meditation. So meditation you can do in your room, or you can go to temple, you can do wherever you want, you can do. So this is what very important, guys. So you are in lot of stress now. Basically, first year exam, very stressful, very, very stressful. So during that, so you need to do yoga, meditation, or you can do some exercise, some 5-10 minutes only. Then you can just go to your study table and you can study. Have light food. Okay, yoga. Okay, okay, good. Chalo. This is okay. This is okay. Now second question. Second question, guys. Let's see who is going to answer. So all of you, Charan, look at this. A 30-year-old male. So 30-year-old male. This is asked in RGUHS, guys. Head injury is there. So patient is having head injury and complaints of sudden increase in urine output. Suddenly there is a urine output. So more than normal. Polyuria is there. So patient is having head injury. So patient is having head injury. Point number one. Point number two, patient is having polyuria. So polyuria is there and polydipsia is there. Polydipsia is there. And patient is having nocturia. Nocturia is there. But if you see the blood glucose level normal, glucose level normal, glucose is normal. Look at the glucose level normal. Specific gravity less than 1, that is 1.005. Or urine volume, if you see 10 liters per day. So urine 10 liters per day. You can see here your urine passage, that is 10 liters per day, and urine glucose is nil. So what is the diagnosis? Hari Prasad and others. Hari Prasad, keep answering, guys. Okay? Okay, so this is basically diabetes insipidus. Insipidus. So diabetes insipidus because of the deficiency of ADH. Remember, because of deficiency of ADH. ADH is secreted by posterior pituitary. And so remember, diabetes insipidus can be of two types. One is nephrogenic. Second one is central. Central. If the cause is there in the kidney, that is known as nephrogenic. If cause is there in the CNS, that is known as central diabetes insipidus. Okay. Yes. So this is what important. Chalo. Chalo. Next, guys. So okay, this is important question. So now all of you just try to remember diabetes insipidus clinical features. So the mnemonic is diabetes, D for dilute urine, I for increased thrust, absence of ADH, bradycardia, electrolyte imbalance, tons of urine, lot of urine, and elevated serum osmolarity. Symptom resolve with the water intake. So all of you write in the chat box, diabetes insipidus is equal to diabetes. So diabetes. Just keep writing. You can take the screenshot and you can save. So this is pakka question. So diabetes mellitus or diabetes insipidus, both are important. Our differences also can be asked. Okay. Okay. So this is about the diabetes insipidus. That's fine. Okay. Okay. Then what are the functions of ADH? Again, it is taken from GKPAL. So GKPAL, thank you, Chasing Dreams. Thank you. So, chalo, what are the functions of ADH? One is basically the absorption of water in the distal collimated tubule and collecting duct. The second one, it also causes vasoconstriction. And third one, it also important in memory. It is also very important for contraction of smooth muscles in the spermatid cord. So all of you write in the chat box ADH function. So what are the functions of ADH? You can write along with me. So ADH function is, the first function is water. So water absorption. Water absorption. So where it acts on the DCT, distal collimated tubule, and that is collecting that. Second one is very important for vasoconstriction, VC. Third, this is also very important for memory. Memory. And the fourth is important for contraction of smooth muscle. So contraction of smooth muscle. So all of you write this in chat box. Very, very important. Very, very important, guys. Keep writing this point in the chat box. Keep writing. Keep writing. Yes, yes, thyroid can come. So thyroid yesterday we discussed. So that is basically a 10 mark or 5 marks question usually. So okay. Hari Prasad, CH. So CH basically inappropriate secretion because of the hypersecretion. So decreased secretion, diabetes insipidus. Hypersecretion, SIADH. Good. So Charan, keep writing. So Charan is writing, sir, ADH, water absorption, vasoconstriction, memory. एक और है smooth, that is smooth muscle contraction of the spermatid cord. So basically four functions, and some students said, sir, it acts on the V1 receptor. Okay, V1 receptor, that is also okay. If you write V1 receptor, examiner will be very happy. So okay, yes, come on, Rahman, can you write? Rahman, can you try? Rahman, keep writing few points in the chat box. Rahman and Shashank, keep writing few points. ADH very important. That's why. Come on, guys, come on. Chalo, this is about diabetes insipidus. You can write in the exam. Chalo, then SIDH. Then comes is the pain pathway. So pain pathway. So yes, pain pathway. Any one word about pain pathway? Pain pathway, as you know, fast pain and slow pain, right? So pain usually of two types, fast pain and slow pain. So very commonly asked. So either pain pathway or pain analgesic pathway or pain suppression pathway. So very commonly asked in the exam. So yes, guys, one word. Malini, can you tell me one word about it? Okay, Malini is telling, sir, paleo spinothalamic tract and neospinothalamic tract. Very good, very good. So yes, so fast and slow pain, Hari Prasad, acupuncture therapy, okay. Acupuncture therapy you can do, that's fine. Okay. Any other word? I think I got Malini, very good. She answered, sir. Paleo, spinothalamic tract and neospinothalamic tract. That's great. So two types of pain, fast pain and slow pain. And remember pain pathway, pain pathway. This you need to write in the exam. All of you concentrate. So this is very important. So infection and injury. So what happens? Infection causes pain, injury causes pain. How? So because of the release of histamine. So because of the release of histamine and prostaglandin, okay, and potassium there. So there will be pain. Then it stimulates the nociceptors. Nociceptor, very important. Okay, nociceptor. Then the impulse go through the A delta and C fibers. So when there is a pain, the impulses go through A delta and C fibers. So from there it goes to dorsal root ganglion. Dorsal root ganglion. From there it relay in lamina 1 and lamina 4. Lamina 1 and lamina 4. Then it goes to go through lateral white column. So lateral white column. So it crosses the opposite side occupi. Then it goes to thalamus. So from the thalamus, so it goes to sensory cortex 3 to 1. So 3 to 1. So this is very important pathway. So this you need to remember. Okay. Sensory cortex. So can I able to write this pain pathway? Shashank Pujar. Infection, injury, release of histamine and that is prostaglandin. Nociceptor stimulated. From there it goes to A delta fibers and the C fibers. Dorsal root ganglion, lamina 1 and 4 crosses to opposite side, occupy position in the lateral white matter tract. So then goes to thalamus. It's a relay center. From where it goes to sensory cortex, that is 3 to 1. 3 to 1. Okay. So this you need to write in the exam. Yes, same like you can draw. This is easy diagram. Same diagram, flow chart, or else you can practice from the standard textbook as well. This is one easy diagram which I got. Okay, pain pathway. Yes, Charan, clear? Pain pathway. Pain pathway, okay. Now you must know what are difference between slow pain and fast pain. So again that is important. So here slow, there is a table. So pain is there. So fast pain or first pain. So fast pain or first pain, it arises immediately. It arises immediately. So due to what fibers? A delta fibers. So all of you remember, the fast pain is because of A delta fibers. A delta fibers. Then it follows which tract? Neospinothalamic tract. Okay. Neospinothalamic tract. So write this in chat box. Fast pain. Slow pain, also known as second pain. So that basically involves that is the due to C fibers, it involves paleospinothalamic tract. So slow pain is because of C fibers. C fibers, you know, nerve fibers are classified into A alpha, A beta, A gamma, A delta. So then the C fibers and also paleospinothalamic tract. Thalamic tract. Write this in chat box. Write this in chat box. Keep writing. Okay, keep writing guys, very important. Pain pathway, pain suppression pathway. So can I able to write, Charan? Pain pathway. Write this in chat box. Yes, Shashank, keep writing few points in the class. You can interact with me and you can keep yourself awake, you can keep myself awake. Very important. Yes. Okay. Yes, Malini, keep writing few points. The fast. Yes, Malini is writing, sir. None. Okay, very good, Malini. Excellent. Excellent answer. Okay. Good. That's great. Ha. Okay, so this is okay. Slow pain. Now I have a question for you. Now see example. this female is doing something in the kitchen. Okay, something in the kitchen. Suddenly, there will be some burn injury. There will be she will touch some heated substance. He might touch the gas stove, which is which is heated basically. That causes pain. Suddenly, it will take out the hand like this. So, what type of pain is this? Slow pain or fast pain? And what is the fiber? What is the fiber basically? Which fiber? And which pain track that is involved? In this scenario, okay? This scenario, fast pain, what is that basically involved? Come on, Malini. Look at this picture and tell me. ಸೊ ಏನೇ ಕೆಲಸ ಮಾಡ್ತಾ ಇರ್ತಾರೆ, ಸಡನ್ ಆಗಿ ಕೈ ಟಚ್ ಮಾಡ್ತಾರೆ, ಸಡನ್ ಆಗಿ ಅವ್ರು ಹಿಂಗೆ ಕೈ ಹೇಳ್ಕೊಂತಾರೆ, ಪೇನ್ ಆಗುತ್ತೆ, ಸಡನ್ ಆಗಿ ಪೇನ್ ಆಗುತ್ತೆ, ಥರ್ಮಲ್ ಸೆನ್ಸೇಷನ್ ಆಗುತ್ತೆ, ಪೇನ್ ಆಗುತ್ತೆ, ಬೋತ್. ದೆನ್ ಶಿ ವಿಲ್ ಟೇಕ್ ಔಟ್ ದಿ ಹ್ಯಾಂಡ್ immediately from that. So what is the fiber that is involved? Yes, come on. Yes, right. Keep answering, guys. Keep answering. So withdrawal reflex. Okay, what is the pain fibers? What is the first pain? I said the first pain, that is basically what? That is A delta fibers. Now look at this. He's the cricketer, so he is unable to move his leg because of the pain. So he was getting pain and he was playing with the pain. So the second pain transmitted by, I said already, what is that? Slow pain transmitted by, yes, that is basically slow pain, that is because of C fibers. Okay, so this is what you need to remember. So can you able to remember these two images, guys? The fast pain and the slow pain. So Viresh Rathod. Good. Chalo. Next. Next is the one more question, important question. So all of you try to answer this. An adult 32 years comes to casualty with history of fall from tree. Okay, fall from tree. So fall from tree. He is unable to move both the limbs. So he is having unable to move. So there is a paralysis. Basically, there is a paralysis. So there is a paraplegia. Okay. Then patient is conscious. Patient is conscious. And tone is increased. There is a hypotonia is there. Hypotonia is there. Then that shows transection. So transection. So transection of the spinal cord. So if what you can see here, this image. So this image, fall from tree, paralysis, conscious, hypotonia is there, and there is a complete transection of spinal cord. What is the diagnosis? So what is the diagnosis of this condition? Yes, right. Keep answering, guys. So can I able to answer? Lower motor neuron disease, what it is? Upper motor neuron lesion, what is the basis of decreased tone? So it is basically a decreased tone, hypotonia is there. Babinski sign is also Babinski sign. So what is the basically? Yes, very good. So this is basically lower motor neuron, but here hemisection is there. So whenever hemisection is given, so transection of spinal cord at the mid thoracic level. So whenever question given hemisection, so here transection given, so it is definitely lower motor neuron palsy, element type of palsy. Sometimes the question can be asked hemisection, so that you need to write. So this is basically element. So element type. So what you can see here, one more question very commonly asked is the Brown-Séquard syndrome. So 3 marks question, very important. So Brown-Séquard syndrome is because of the penetrating trauma, because of the hemisection of the spinal cord. Affected side, there's a loss of motor, vibration, motor and position sensation, and opposite side there's a loss of pain and temperature sensation. So this is very important, guys. Brown-Séquard syndrome. Let's go through this after the class. You can take the photo of this. So then comes is difference between UMN and LMN palsy. Very, very important. So difference between UMN and LMN palsy. Very important. Very, very commonly asked. So very, very commonly asked. So in exam, you need to write about these points. So upper motor neuron lesion and lower motor neuron lesion. Upper motor, what is the site of lesion? The site of lesion is cerebral hemisphere, cerebellum, brainstem, and spinal cord. So as you know, brainstem is made up of midbrain, pons, and medulla. So this is the site of lesion in upper motor lesion. Lower motor neuron, basically because of antrehorn cells, or because of the nerve root, or because of peripheral nerve, or neuromuscular junction, or the muscles. So this is also important concept. So this is the concept number 1, very important concept. What is the site of lesion in upper motor neuron and lower motor neuron? Upper matlab basically cerebral hemisphere, cerebellum, brainstem, and the spinal cord. Lower motor basically that is antrehorn cell, peripheral nerve, all this. Muscle weakness. So in case of upper motor neuron lesion, so there can be quadriplegia, there can be paraplegia, there can be hemiplegia, there can be diplegia as well. But here, in case of lower motor neuron, proximal myopathy will be there and distal neuropathy will be there. Muscle tone. So in UMN, there will be spasticity of the muscle. But here, there will be hypotonia. So all of you write in the chat box, LMN is equal to hypotonia, decreased tone of the muscle. UMN is equal to spasticity. Spasticity. So write this in chat box. So write this in chat box, then we will continue. So antrehorn cell, that is basically antrehorn cell. Yes. So all of you write in chat box. Spasticity occurs in UMN. Hypotonia occurs in LMN. Fasciculations, that is absent in case of UMN, present in case of LMN. Tendon reflexes, hyperreflexia here. Abdominal reflexes, absent in UMN, present in case of LMN. Sensory loss, basically cortical sensation, but here peripheral sensation. Okay, so this is, you need to write at least 5 important differences between UMN and LMN. So very, very important question. Very important. Chalo. So now we are going to discuss about, yes. Okay, this is spasticity, UMN, LMN. Okay, that's fine. Now Babinski sign. One more very, very important question. Babinski sign. Very important. So can anyone tell me what is normal Babinski sign? What is normal reflex and what is positive and what is negative? Can anyone tell me? Viresh Rathod is telling, sir, UMN it is exaggerated. That's great. That's great. So my question is, Viresh, so what is normal and what is abnormal? Is it a plantar flexion normal or that is the dorsal flexion that is normal? Can anyone tell me? Yes, come on, Babinski sign. For this, you must know this image. So all of you guys, negative or normal, that is plantar flexion of all toes. So when there is a plantar flexion of all toes, that is normal or that is negative. Plantar flexion. So what is abnormal? The abnormal Babinski sign or positive Babinski sign is dorsiflexion of the big toe. Dorsiflexion of the big toe, and other toes are the panning out. Other toes are panning out. You can see here. So this is positive. That is basically in case of UMN, Babinski reflex, very commonly asked. Okay, plantar flexion. So plantar flexion is normal, and dorsiflexion of the great toe, panning out of the other fingers is known as Babinski sign, that is positive in case of UMN. UMN. So this is very, very important, guys. You need to memorize. Chalo, ठीक है. Now comes this very, very important topic, that is types of sleep. Types of sleep. Charan, okay? All okay, all guys, very interesting now. Types of sleep. The sleep is very important in anyone's life. I know for the it has various function. The question asked in the exam. So what are types of sleep? As you know, it's very important. So NREM sleep and REM sleep. Very simple, right? NREM sleep. NREM. Then in NREM, 1, 2, 3, and 4. So then comes is your REM sleep. So REM sleep. Okay. So what is 1? So what is 2 and all? So light sleep, है ना? Light sleep. Light sleep is, that is 1. So moderate, है ना? So अच्छा. So Malini like only this activity when free. ठीक है. Now good. Now tell me. So in which type of sleep? So brain activity is high. Brain activity is high. Can anyone tell me? Or one more question for you. Dreams. In which state dreams do occur? Dreams. We say no, good night, sweet dreams. So look at this baby, very cute baby. So good night, sweet dreams. So my question is, sweet dreams occurs or bitter dreams occurs in which stage of the sleep? Come on, come on. REM sleep. Excellent answer, Charan. Charan said, sir, it occurs in case of REM sleep. Excellent. So dreams occurs in case of REM sleep. Very good. Rapid eye movement sleep. What about night terror? So night terror. Terror बोलते हैं हम, है ना? Night terror. In which sleep it occurs? Can anyone tell me? Viresh Rathod, okay. Now dreams, okay. Dreams in REM. Dreams in REM, Shashank Pujar, correct. If the terror, we can say terror, ಸಡನ್ ಆಗಿ ಏನೋ ಕನಸು ಬೀಳುತ್ತೆ, ಬ್ಯಾಡ್, ಸಡನ್ ಆಗಿ ಎದ್ದು ಹೇಳ್ತೀರಾ, ಭಯ ಆಗುತ್ತೆ. ಸೊ ಬಟ್ ವಿಲ್ ನಾಟ್ ರಿಮೆಂಬರ್ ಎನಿಥಿಂಗ್. ಸೊ ಕೇಳಿದ್ರೆ ಇಲ್ಲ, ಏನು ನೆನಪಿರಲ್ಲ. ಸೊ ದಟ್ ಇಸ್ ನಾಟ್ ಡ್ರೀಮ್ एक्चुअली, ದಟ್ ಇಸ್ नोन एज नाइट टेरर. रेम में होता है? नो. तो रेम, NREM, very good. NREM, it occurs in NREM. Very good, Malini. It occurs in NREM. So NREM. So in exam you need to write about this. Basically about now see this man. Now look at this. So this man, now he was very normal while sleeping. Now can anyone tell me what is the state of sleep right now he is in? So ಯಾವ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಇದ್ದಾರೆ? ಆರಾಮಾಗಿ ಹೀಗೆಲ್ಲ ಮಸಲ್ ಮೂವ್ಮೆಂಟ್ಸ್ ಆಗ್ತಾ ಇದೆ. ಓಕೆ, ಓಕೆ, ಕಮ್ ಆನ್, ಟೆಲ್ ಮಿ ವಾಟ್ ಇಸ್ ದಿಸ್ ಸ್ಲೀಪ್? So basically this is the deep sleep, right? So in exam you need to write about REM sleep and NREM sleep. REM, rapid eye movement. So when you see the eye movement, rapid eye movement. So but in NREM, slow eye movement. There will be drowsiness. ठीक है? Then body movement, muscle twitches. Here muscle relaxation. So muscle twitches occurs in REM, muscle relaxation occurs in case of NREM. Vital signs, when you check blood pressure and heart rate and all, that is fluctuating in case of REM, but that is stable in case of NREM. That muscle tone decreased in REM, muscle tone decreased. Then, but here there can be some tone in postural muscle. The penile erection is very common during REM sleep, but that is very rare in NREM sleep. Dreams do occur in REM sleep, rare in case of NREM. EEG. So when you take the EEG, low voltage waves. But in REM, you will see spindles, You will see V waves, K complexes, slow waves. The percentage of sleep is 20-25, that is REM, 75 to 80, that is basically NREM. So this is what important. In infants, it is 50-50. REM 50, NREM 50. Say example, say I'm going to sleep for 6 hours. Now you tell me, all of you, REM ಎಷ್ಟಾಗತ್ತೆ ಇದರಲ್ಲಿ, NREM ಎಷ್ಟಿರುತ್ತೆ, ಎಷ್ಟು ಅವರ್ ಇರುತ್ತೆ? So my question is, all of you guys, now say I'm going to sleep at 12 o'clock. I'm going to getting up from the bed around 6 o'clock. So 6 hours sleep. In 6 hours sleep, in the beginning NREM होगा, NREM 1, 2, 3, 4 होगा. After that REM cycle, every 1.5 hour, every 2 hours. Then again NREM, then again REM. My question is, in 6 hours sleep, how much is the duration of REM sleep? How much is the duration of NREM sleep? Okay, come on, okay. Keep answering. 90 minute REM. अच्छा, hours में बोल दो आराम से, ठीक है? 90 minutes, correct. So REM is around 90 minutes. So 1.5 hour. This is around 4.5 hour. So 4.5 hour. So for a proper brain activity, you need some amount of REM sleep every day. Okay, the proper brain activity and memory function. So to prevent depression, psychosis and all, REM sleep is important. Okay, so lack of sleep can induce so many psychological problems. Okay, so try to understand this. Okay, 90 minutes each cycle. REM around 3 hours in REM. So that is Viresh, that is in infant. I am adult now. I can see here. So you can see now here percentage in adults 75-80, that is NREM. 20-25, that is REM. ठीक है, total duration. चलो ठीक है. Now you need to write about a few points about. Okay, now this is very interesting image. Now look at this. This is a girl here. So girl, our medical student now. Now she is going to sleep. So all padhai sab kuch done. So now she is going to sleep. Okay. So the first sleep will be like this. NREM. NREM stage 1. NREM stage 1. It forms around 2 to 5% of each cycle. So light sleep occurs, first stage. Then what happens? Then stage 2. Stage 2. So around 45 to 50% of the total cycle. So there will be K complexes and sleep spindles occurs. So that is in the stage 2, that is moderate sleep. Then comes is your stage 3, where high arousal threshold is there. So here also high, here low arousal. So stage 1 ಅಲ್ಲಿ ಇದ್ರೆ ಎಬ್ಸ್ಬೋದು ಆರಾಮಾಗಿ. 2, 3, 4 ಅಲ್ಲಿ ಇದ್ರೆ deep sleep. So then comes is your NREM. Then comes is your REM sleep. Around 20-20% of the REM sleep. High arousal threshold again. So the person may jump in between the if he is woken. So this is what you need to remember. Muscle atonia occur, dreaming occur, burst of REM that occurs in the REM sleep. So this is what important. And also remember, so all this fluctuation of BP and all that occurs in case of REM sleep. So this is very important. Okay, so I have understood, guys. So this is how the sleep cycle occur. Chal. Then what are the disorders of sleep? So one is insomnia. Insomnia, difficulty in getting sleep, insomnia. Sleep apnea. Sleep apnea. Hypersomnia. Narcolepsy. Parasomnia. So you can write whenever question asked. So the 5 important applied aspects of sleep: insomnia, difficulty in sleep or lack of sleep, insomnia, nidya barla, insomnia, sleep apnea, hypersomnia, narcolepsy, and parasomnia. Okay, this you can write in the exam. So that's about the sleep now. Okay. Okay, next comes is waves of EEG. Very important. Waves of EEG, guys. So what are the waves of EEG? Come on, guys. What are the waves of EEG? Very simple question. So again, this is 3 marks question. 3 marks or 5 marks question. Waves of ECG. So this is again simple question, guys. So you need to start with the beta. Beta. So the speed is around 12 to 30. It commonly occurs when person is focused. So focused. So this is how beta waves looks. Alpha, the speed is around 8 to 12 hertz. It commonly occurs relaxed when eyes closed, when eyes are closed, when mind is relaxed. So that is basically alpha. Theta, that is about 4 to 8. Drowsy, so in drowsy there are theta waves. Delta, the speed is very slow, 1 to 4 hertz. It commonly occurs in case of deep sleep. Deep sleep. Alpha, beta, gamma, theta. That's great. So all of you good. Good answer. You can remember delta, D for delta, D for deep sleep. So all of you write in the chat box, beta is equal to focused. So when person is focused, so you will see beta waves. Beta is equal to focus. Keep writing, guys. Beta is equal to focused. Yes, good, Charan. So Charan is answering very well. Charan, great. Then what are the uses of EEG? So what are the uses of EEG? One use is seizure disorder. When person having epilepsy, when person is having convulsions, you can do EEG to find out the cause. Or when person is having sleep disorders, hypersomnia, insomnia, parasomnia, so this is okay. Then dementia, the person having dementia or head injury, concussion injury, encephalitis, in all these conditions, EEG can be done. So the question can be asked in exam, what are the uses of ECG, what are the uses of EEG and what are the waves in EEG? You need to write these points. These points. Okay? Beta is equal to focus. That's fine. Okay. Next. Now look at this very important question, guys. All of you concentrate. Concentrate now. So a young married couple. So recently married, just married. So visited their family doctor for advice contraceptive methods. So doctor prescribed combined oral contraceptive pills. Explain the mechanism of action of oral OC pills. What are the other methods in females? So all of you concentrate. Contraceptive method, very important. Contraceptive methods, very, very important. So all of you concentrate. So male and female. So as you know, permanent method in male, that is the vasectomy. Permanent method is female, that is the tubectomy. And there are barrier methods, there are hormonal methods, so copper devices and all, right? So let's see what are the methods of contraception from GK-POL. So in GK-POL, this is what given. Contraceptive methods are classified into following categories. Barrier methods, barrier method. Physical method, chemical method. Physical method, like example, condom, male condom, female condom. Chemical methods, like example, by using spermicidal jelly, okay, chemical method. Are intrauterine devices. So by placing intrauterine copper T device. Or it can be hormonal methods, like estrogen and progesterone. Estrogen in the form of ethinyl estradiol. Progesterone in the form of norgestrel. Okay, norgestrel. Or post-conceptional method, that is known as I pill, emergency pill. Then permanent methods. So permanent method basically vasectomy, and tubectomy. So this is what you need to write in the exam. So this is very, very important. The classification very commonly asked. ठीक है? So चलो. Yes. All of you okay? ठीक है? Now, what are the hormonal methods? Now before that, so all these are copper T devices. So all of you remember, this is copper T 200. Copper T 200. This is multi-load 375. This is copper T 380A. Copper T device. And this is levonorgestrel containing intrauterine device. See, the copper T devices are again classified into first generation, second generation, and third generation. So all these hormonal containing are basically third generation copper T devices. Copper T devices. Good. Then, what are the methods of hormonal contraceptive? So either it can be OC pill, that is known as combined pill, or it can be only progesterone containing pill, postcoital pill, once a month pill, gossipol, that is male pill, and there are some depots, that basically slow releasing formulations. What are they? Injectable preparation, subcutaneous implants, and vaginal rings. So all these are basically hormonal contraceptives. Hormonal contraceptives, very, very important. Now you need to identify, so what is this basically? Now some image based question, come and try all of you. What is this? Gossipol. All of you keep answering, keep answering. What is gossipol? So gossipol is male pill. Male pill. Next. Next. Now this is basically, can you identify what is this basically? Identify this. So there are 21 pills are there, and there are 7 tablets are there, that is 7 tablets of iron. So all these are basically iron. So what is this basically? Identify this. Viresh, what is this method? So 7, 1, 2, 3, 4, total 28 are there, 28 tablets. What is this 28 tablets? Gossipol is male pill, that's okay. What is this? Emergency pill? No, it is not emergency pill. No. So this is taken every day, okay, for 21 days. In case of young couple, young married couple, to prevent pregnancy. What is that basically? Not emergency pill. Emergency pill will not look like this. There will not be 28 tablets. What is this? Come on, try. Come on, try. Try. Malini, Charan, Viresh Rathod, Shashank Pujar. Shashank, what is this? Okay, this is used to control. Okay, I know what is this actually. So these are basically OC pills. OC combined pills. Combined pills. So this consists of ethinyl estradiol, and some progesterone component. Progesterone. So when it consists of both estrogen and progesterone, then it is known as combined pill. Combined pill. Okay, these are combined pill. Next. This is levonorgestrel. That is actually a progesterone containing pill. And this is the spermicidal jelly, which is known as nanoxenol. Nanoxenol. Nanoxenol jelly. Okay, this is basically spermicidal jelly. Now look at this image. Can identify what is this barrier method? What is this barrier method? What is this barrier method? Which is having two rings. You can see here one outer ring and inner ring. So is it male condom or female condom? Male condom or female condom? So this is basically female condom. So which is a type of barrier method? Female condom. And this is basically male condom. And this is vaginal ring. Vaginal ring. And this is what tubectomy looks. The tubectomy. Okay. So tubectomy is also very commonly asked question. Tubectomy and vasectomy. So tubectomy. And what is this basically? This is NAR plant. So this is NAR plant. NAR plant. NAR plant. चलो ठीक है. So then this is vasectomy in males. Vasectomy in males. Vasectomy in males. So this completes your question number 9. And the last question. So what is the classification of nerve fiber? What is the classification of nerve fiber? So when this question asked, you need to write about Erlanger Gasser classification. So what is that basically? Erlanger Gasser, A alpha, A beta, A gamma, A delta, B and C. B and C. So A, B, C, A alpha, A beta, A gamma and A delta. A alpha basically, Prime Minister is a mnemonic. Prime Minister. P for proprioception. Proprioception. M for motor. Motor. So basically A alpha carries proprioception and motor. What is the diameter? 12 to 20. So they are myelinated. The speed is around 70 to 120. 70 to 120. A beta, they carry pressure and touch. 5 to 12 is the diameter. 3 to 70 is the conduction speed. A gamma, muscle spindle. 3 to 6, 15 to 30 is the speed. A delta, touch, cold and fast pain. 2 to 5 is the speed. So 2 to 5 is the diameter and 12 to 30 is the conduction. Then B is autonomic. Autonomic nerve fibers means sympathetic and parasympathetic. And remember, they are unmyelinated. So they have less speed and they have less diameter. And C fibers, basically autonomic again, they carry slow pain. We discussed slow pain. C fibers, 0.3 to 1.3 is the diameter, 0.7 to 2.3 is the conduction velocity. So this is what you need to remember. This is what known as Erlanger-Glasser classification. So pakka question in upcoming exam. This is very, very important. Erlanger-Gasser classification of nerve fiber. ठीक है? चलो. Next. Then 10 more important questions. . Heat gain and heat loss, very important. The heat gain and heat loss. Okay, heat gain and heat loss, very important question. The second important question, Papage circuit. So after the class, just go through this Papage circuit. Then actions of glucocorticoids, Cushing syndrome, Addison's disease. Properties of sensory receptors, Wallerian degeneration and regeneration of neurofiber. Ratchet theory of muscle contraction, very important. Then stretch reflex and importance. Errors of refraction like myopia, hypermetropia, astigmatism, presbyopia, and contents of middle ear. Both are very important. So these two are very important questions. Then comes the referred pain. Referred pain in heart attack. What are the theories of referred pain? And the growth hormone. So what are the functions of growth hormone? What are differences between pituitary dwarfism and thyroid dwarfism? Very commonly asked. So what is the mechanism of action of growth hormone? What are the features of acromegaly? Acromegaly is very commonly asked. Acromegaly. So this is important, guys. So just go through this. So just go through this after the class. After the class, just go through this. All 20 questions. So chasing dream, you don't worry. Work hard. Don't do any comparison. You do your work. You do your work as much as possible. Don't do any comparison. No comparison in life. The comparison is a source of depression. The comparison is a source of negativity. The comparison is a source of all sorrows in life. No happiness in comparison. Don't do comparison. Okay, rigor mortis, yes, rigor mortis can be asked. The stiffening of muscles after death because of ATP depletion. It involves voluntary, involuntary muscle. So very commonly as rigor mortis, yes, Malini. If you want to, only once asked, okay, only once this question asked. Rigor mortis. ठीक है, rigor mortis. Some student answered. Some student. So this is about the physiology. So you are having 48 hours. So tomorrow and day after tomorrow, go through all these 40 topics, revise. Go through all PYQs and revise. Revise your notes. Revise your notes. You will definitely pass. Okay. So why are you creating such an hype for exam? Hype. Why hype? Tejas Neha, are you preparing for first year exam? Are you first year student or NEET PG student or NEET UG student? I don't know. Exam is exam. Okay, exam is exam. Every exam has importance. Do your best. Leave stress. As a first year student. First year. Exam going. Are you exam going student? No. Okay. Chalo, ठीक है, no problem. ठीक है, any other doubt, guys? Any other doubt? Any doubt regarding preparation, you can ask me. No, tomorrow I'll let you know. Tomorrow I'll let you know, Malini. If I'm free, I can take. Okay. But already I have covered 2 classes. I think this is sufficient. EdCom, so you can read yourself. EdCom is easy. Question from integrative physiology. Integrated physiology. So that you can go through. Again, thyroid, anemia, and all, right? Hmm? Diabetes mellitus, diabetes commonly asked. So integrated physiology, one is well-fed state. Okay, so this is diabetes mellitus, one important question. Thyroid, so can be a question, integrated physiology. Then the question can be asked from shock again, that is in paper 1. Okay, paper 1. RGUHS beta, this is RGUHS. RGUHS Karnataka. Same sir, this holistic approach, that's okay. So any doubt you can ask me for next 5 minutes. Yes, come on guys, come on, keep answering, keep. Any doubt? Malini, Charan, Shashank. So MCQ you cannot predict. Malini, MCQ you cannot predict. So reasoning questions also we cannot predict. But reasoning questions in physiology usually come from the topics we discuss in a class and usually the major concepts. Not that difficult. Because paper 1 I think was easy. Easy one. Okay, stress is there. Okay, stress is one more topic. Okay, stress, that is from integrated physiology. Oh, temperature, yes, temperature regulation, integrated physiology. So what are the changes in cold and what are the changes in heat? So these four are important: stress, diabetes mellitus, thyroid related question, and temperature. So rest all easy only. So with this, I'm going to end the class, today's class. All of you, wish you all the best. So tomorrow and day after tomorrow, study well, work hard, revise. Thank you all.